to arrive fully here. Breathe in slowly and deeply, then exhale with a gentle release. Let yourself be present and relaxed. Today, we're going to explore how to build a gentle weekly skincare plan, a sustainable, organized approach that supports your skin without overwhelming it or you. A weekly skincare plan brings structure and intention to your routine. It helps you maintain consistency with your basics while creating space for treatments and special care when appropriate. It prevents over-treatment while ensuring you're doing enough. Think of it as a gentle rhythm for your skin, a predictable pattern that allows your skin to thrive. The beauty of a weekly plan is that it removes daily decision-making. You know what you're doing each day. You're not constantly wondering if you should use a treatment tonight or if you're doing too much or too little. The plan becomes your guide, and following it becomes automatic. Let's begin by establishing the foundation, your daily non-negotiables that form the backbone of every single day, regardless of what else you might do. Every morning, without exception, you need 3 essential steps: cleansing or rinsing, moisturizing, and sun protection. These 3 steps maintain your skin's health and protect it from the primary external cause of damage, UV radiation. No matter what else varies in your weekly plan, these morning basics remain constant. Every evening, you need gentle cleansing to remove the day's accumulation, followed by moisturizer to support your skin's overnight repair. These evening basics are also constant, creating a reliable foundation your skin can count on. So your basic daily rhythm looks like this. Morning, cleanse or rinse, moisturize, apply sunscreen. Evening, cleanse thoroughly, moisturize. This is your foundation. Simple, consistent, sustainable. Everything else in your weekly plan builds upon this foundation without replacing it. Now let's discuss how to incorporate treatments and additional care into your weekly rhythm without overwhelming your skin. If you're using active treatments, retinoids, vitamin C, acids, or other potent ingredients, you'll schedule these intentionally rather than using them randomly or daily. Most people don't need daily use of actives, and many skins can't tolerate it. Strategic, spaced-out use often works better. Let's build a sample, gentle weekly plan together, and then you can adapt it to your specific needs. Monday through Sunday, your foundation routine every single day, morning and evening, as described above. Now we add treatments thoughtfully. Let's say you want to use a retinoid for anti-aging and cell turnover, and a gentle acid treatment for texture and brightness. Here's how you might schedule these. Monday evening, basic routine only, no treatments. Tuesday evening, basic routine only, no treatments. Wednesday evening, apply retinoid after cleansing, before moisturizer. Use your regular moisturizer on top. Thursday evening, basic routine only, no treatments. This rest day allows your skin to recover from the retinoid. Friday evening, basic routine only, no treatments. Saturday evening, apply acid treatment after cleansing, then moisturizer. Or do a gentle enzyme mask for 10 to 15 minutes before your regular routine. Sunday evening, basic routine only, no treatments. Notice the pattern. Treatments are separated by several days, never used consecutively. Your skin gets ample recovery time between active treatments. Most of your week is simply gentle basics, which is exactly what your skin needs. If you're just beginning to use actives, start with less frequency. Perhaps retinoid only once per week for the first month, then gradually increase to twice weekly if your skin tolerates it well. Patience prevents irritation and allows your skin to build tolerance. Let's consider another example. Someone dealing with oily, acne-prone skin who wants to use salicylic acid and niacinamide. Daily foundation routine. Gentle gel cleanser. Morning and evening. Lightweight oil-free moisturizer. Sunscreen in the morning. Monday evening. Salicylic acid treatment after cleansing, then moisturizer. Tuesday through Thursday evenings. Basic routine only. Friday evening, salicylic acid treatment after cleansing, then moisturizer. Saturday and Sunday evenings, basic routine only. The niacinamide could be in their daily moisturizer or serum, used every day as it's gentle and well tolerated. The salicylic acid, being more active, is used only twice weekly with several days between applications. For someone with dry, sensitive skin focusing on barrier repair and hydration, daily foundation routine, cream cleanser, evening only, water rinse in morning, rich moisturizer with ceramides, gentle mineral sunscreen, every evening. After cleansing, layer a hydrating toner, then a barrier repair serum, then moisturizer, topped with a facial oil. Sunday evening, add a hydrating sheet mask or cream mask before your regular routine, or simply do an extra generous application of moisturizer and facial massage for 5 to 10 minutes. Notice that this routine has no actives, just layers of hydration and barrier support. The weekly variation is minimal, with Sunday as a day for extra pampering and hydration. This simplicity is perfect for sensitive skin that needs gentleness above all. Let's talk about incorporating masks, treatments, and special care into your weekly rhythm. Many people enjoy using masks as a weekly ritual. This is lovely if you enjoy it, but remember that masks are optional, not essential. If you use them, choose masks appropriate for your skin's needs and schedule them strategically. Hydrating masks can be used more frequently, even several times per week, as they're gentle and nourishing. These are perfect for any evening when your skin feels particularly dry or tired. Clay or purifying masks for oily or congested skin should be used less frequently, perhaps once weekly or every other week, as they can be drying. Always follow with good moisturization. Exfoliating masks, whether physical or chemical, count as active treatments and should be scheduled carefully, ensuring you're not over-exfoliating. Sheet masks are typically hydrating and gentle, making them suitable for weekly use or whenever your skin needs a boost. Consider designating one evening per week as your spa night, perhaps Sunday, when you have extra time for masks, extended facial massage, or simply a more luxurious, mindful version of your regular routine. This creates something to look forward to and turns skincare into self-care ritual rather than mere maintenance. Let's discuss morning variations in your weekly plan. Most people benefit from keeping mornings simple and consistent. The basic cleanse or rinse, moisturize, and sunscreen routine is usually sufficient. However, you might incorporate a vitamin C serum in your morning routine if you choose. Vitamin C provides antioxidant protection and works beautifully under sunscreen. If using vitamin C, you could use it every morning or just several mornings per week. Monday, Wednesday, Friday, for example. Apply it after cleansing, before moisturizer and sunscreen. This regular pattern is easy to remember and provides consistent antioxidant benefits. Now let's talk about adjusting your weekly plan based on your skin's feedback. Your weekly plan should be flexible, not rigid. If on Wednesday your skin feels irritated or sensitive, skip that evening's retinoid and just do your basic routine. If your skin is looking particularly congested on Thursday, you might add an extra gentle cleanse or use a clay mask that evening, even if it wasn't scheduled. The plan provides structure, but your skin's current state always takes precedence. Learn to read your skin's signals and adjust accordingly. If you notice your skin becoming irritated despite following your plan, you're probably using actives too frequently or they're too strong. Scale back. If your skin is thriving but you're curious about increasing active use, add one more application per week and observe carefully for a month before increasing further. Seasonal adjustments to your weekly plan are wise. In winter, you might reduce active treatments and increase hydration and protection. In summer, you might tolerate actives better, but need lighter moisturizers and more diligent sun protection. Hormonal fluctuations might also influence your plan. Many people find their skin more sensitive during certain times of their menstrual cycle and might skip actives during those days or need extra soothing care. Let's address how to build a plan when you're just starting your skincare journey. If you're new to skincare, start with just the basics for at least a month. Gentle cleansing, good moisturizer, daily sunscreen, no actives, no treatments, just simple foundational care. This allows you to establish consistency and understand how your skin behaves with basic care alone. After a month of consistent basics, if you want to address a specific concern, add one treatment, just one, using it once or twice weekly. Give this at least another month before adding anything else. This slow, methodical approach prevents overwhelm, allows you to identify what actually helps, and minimizes risk of irritation. Building a sustainable routine slowly is far better than jumping into an elaborate plan that you'll abandon after a few weeks because it's too complicated or causing problems. Let's talk about time management within your weekly plan. Your daily basics should take no more than 5 to 10 minutes morning and evening. If it takes longer, your routine is probably too complicated. Simplify. On evenings with treatments, you might add 5 minutes for application and absorption. On spa nights with masks, you might spend 30 minutes total. But most of your week should involve just those quick, simple basics. Efficiency doesn't mean rushing. You can be efficient and mindful simultaneously. Take your cleansing minute to breathe and be present. Apply products with gentle intention rather than hurried slapping. This transforms your routine into a brief meditation rather than a chore. Consider how your weekly plan fits with your life rhythm. If you're exhausted every Monday, don't schedule treatments Monday evening. Keep it simple. If weekends are when you have more time and energy, that's when to schedule masks or more elaborate care. Your weekly plan should enhance your life, not burden it. It should feel sustainable and appropriate for your actual lifestyle, not some idealized version of life you don't live. Let's address tracking and adjusting your plan over time. Some people benefit from writing out their weekly plan and checking off completed days. This can help with accountability and consistency. Others find this too rigid and prefer a more intuitive approach with general guidelines rather than strict schedules. Take periodic photos of your skin, perhaps monthly, to track progress. When you see your skin every day, gradual improvements can be hard to notice. Photos provide objective evidence of whether your weekly plan is working. If after 2 or 3 months you're not seeing the improvements you hoped for, reassess. Perhaps you need to adjust active frequency, switch products, or address lifestyle factors like sleep, stress. Welcome to this peaceful moment. Settle in and let's begin with a breath. Breathe in slowly through your nose. Hold for a moment and exhale completely through your mouth. Feel your body relax with that exhale. Today we're going to explore something remarkable, how something as simple as breathing can profoundly affect your skin's health and appearance. Breathing is something you do automatically, thousands of times each day, without thought. But when you bring conscious awareness to your breath, when you use it intentionally, it becomes a powerful tool for managing stress, supporting circulation, and promoting skin health. Let's start by understanding the connection between breath, your nervous system, and your skin. Your autonomic nervous system has two main branches: the sympathetic nervous system, which activates your stress response, and the parasympathetic nervous system, which promotes rest, relaxation, and healing. Your skin's health is significantly influenced by which system is dominant. When your sympathetic nervous system is activated, when you're stressed, your body produces cortisol and adrenaline. Blood flow is redirected away from your skin toward your muscles and vital organs. Your skin produces more oil. Inflammation increases. Healing slows. Your skin barrier weakens. We discussed these effects in our previous conversation about stress. When your parasympathetic nervous system is activated, when you're relaxed, opposite effects occur. Cortisol levels drop. Blood flow to your skin increases, bringing oxygen and nutrients while carrying away waste products. Inflammation decreases. Healing accelerates. Your skin barrier strengthens. Cell regeneration improves. Here's what's remarkable. Your breath is a bridge between your conscious and unconscious systems. While you can't directly tell your heart rate to slow or your blood pressure to drop, you can control your breath. And when you breathe slowly and deeply, your breath sends a signal to your nervous system. We're safe, we can relax. This activates your parasympathetic response. This isn't mystical or metaphorical, it's physiology. Slow, deep breathing stimulates the vagus nerve, the main nerve of your parasympathetic nervous system. This activation cascades throughout your body, including your skin. Let's explore specific breathing techniques that support relaxation and skin health. Diaphragmatic breathing, also called belly breathing, is foundational. Most people breathe shallowly into their chest, especially when stressed. This rapid, shallow breathing reinforces your stress response. Diaphragmatic breathing does the opposite. Place one hand on your chest and one on your belly. Breathe in slowly through your nose, allowing your belly to expand like a balloon. Your chest should move minimally. The movement should be in your abdomen. This is your diaphragm descending, allowing your lungs to fill fully. Then exhale slowly through your mouth, feeling your belly deflate. Practice this for a few minutes daily. Over time, this deeper breathing pattern can become more automatic. The 4-7-8 breathing technique is particularly effective for relaxation. Breathe in through your nose for a count of 4. Hold your breath for a count of 7. Exhale completely through your mouth for a count of 8, making a whooshing sound. Repeat this cycle 3 to 4 times. This pattern is deeply calming and can help quiet a racing mind or reduce anxiety. Box breathing, used by athletes and military personnel for stress management, is another powerful technique. Visualize a box as you breathe. Inhale for 4 counts. Hold for 4 counts. Exhale for 4 counts. Hold empty for 4 counts. Repeat several times. This creates a rhythm that calms your nervous system and helps you feel centered and grounded. Alternate nostril breathing from yoga traditions balances your nervous system. Use your thumb to close your right nostril and breathe in slowly through your left nostril. Close your left nostril with your ring finger. Release your thumb and exhale through your right nostril. Inhale through your right nostril. Close it and exhale through your left. This is 1 round. Continue for several rounds. Many people find this technique particularly soothing and centering. When should you practice these breathing techniques? Any time, but especially during stressful moments before sleep, upon waking, or during your skincare routine. Your morning and evening skincare rituals are perfect opportunities to incorporate conscious breathing. As you cleanse your face, breathe deeply. As you apply your products, maintain slow, relaxed breathing. This transforms your skincare routine from a task into a meditative practice that benefits both your mind and your skin. Now let's discuss the direct effects of proper breathing on your skin. Oxygen is essential for every cell in your body, including your skin cells. When you breathe deeply and fully, you increase the oxygen content of your blood. This oxygen-rich blood circulates to your skin, supporting cellular energy production, repair processes, and overall vitality. Skin that receives adequate oxygen has a healthy, vibrant appearance, that natural glow that can't be replicated by products alone. Improved circulation from relaxation and deep breathing means your skin receives more nutrients. Everything your skin needs to be healthy, vitamins, minerals, amino acids, antioxidants, reaches your skin cells via your bloodstream. Better circulation means better delivery of these essential nutrients. Waste removal improves as well. Your skin cells, like all cells, produce metabolic waste products. These need to be carried away for your skin to function optimally. Good circulation, supported by proper oxygenation and relaxation, enhances this detoxification process. Collagen production benefits from reduced stress and improved oxygenation. Collagen synthesis requires oxygen and numerous nutrients. When your cells are well oxygenated and your stress hormones are low, your skin can produce collagen more effectively. Your skin's barrier function strengthens when you're relaxed. Remember, chronic stress weakens your skin's protective barrier. Relaxation does the opposite, allowing your skin to maintain its integrity and protect itself from environmental stressors, irritants, and moisture loss. Inflammation reduces. This is perhaps one of the most significant benefits. Chronic low-level inflammation, often driven by stress, contributes to aging, acne, rosacea, and numerous other skin concerns. Practices that activate your relaxation response, including conscious breathing, reduce this inflammation. Let's talk about facial exercises and facial massage, both of which can be combined with breathing for enhanced benefits. Facial massage, when performed gently, can improve lymphatic drainage, reduce puffiness, and promote relaxation. As you apply your skincare products, take an extra 2 minutes to massage your face. Use gentle upward strokes. Work from the center of your face outward. Use light pressure. You're not pushing hard, just encouraging movement of fluids and gentle stimulation of your skin. As you massage, breathe deeply and slowly. With each exhale, release any tension you're holding in your face. Your face holds stress, just like your shoulders or back. Your jaw might be clenched. Your forehead might be furrowed. As you breathe and massage, invite these areas to soften and release. Gua sha and facial rolling tools can enhance facial massage. These tools, used gently with appropriate pressure, can feel wonderful and support lymphatic drainage. However, they're not necessary. Your fingers work beautifully too. What matters most is the gentle attention you're giving to your face, combined with relaxed breathing. Let's address progressive relaxation, a technique that can reduce overall tension and benefit your skin. Starting with your toes, tense each muscle group for a few seconds, then release completely. Move up through your body, feet, calves, thighs, abdomen, chest, hands, arms, shoulders, neck, face. Notice the difference between tension and relaxation. This practice helps you become aware of held tension and releases it, reducing the physical manifestations of stress on your skin. Mindfulness meditation, which often focuses on breath, provides significant skin benefits. When you practice observing your thoughts without judgment, when you return your attention to your breath again and again, you're training your nervous system to be less reactive to stress. Over time, regular meditation practice can reduce baseline stress and anxiety levels, which directly benefits your skin. You don't need hours for these practices. Even 5 minutes of conscious breathing daily makes a difference. The key is consistency. Daily practice, even if brief, creates cumulative benefits that occasional longer sessions cannot match. Make relaxation and breathing part of your overall skin health strategy. You invest time in choosing products, applying them carefully, protecting your skin from the sun. Invest a few minutes daily in breathing and relaxation too. This internal work supports and enhances all your external skincare efforts. Notice how your skin looks and feels when you're relaxed versus when you're stressed. Pay attention to this connection in your own body. You might notice that after a restful vacation, your skin looks radiant, or that during stressful work periods, your skin becomes problematic. These aren't coincidences. They're your body showing you the mind-skin connection. For those with specific skin conditions triggered or worsened by stress, breathing and relaxation practices can be particularly valuable. If you have stress-triggered acne, eczema flares, or rosacea outbreaks, incorporating daily relaxation practices might reduce the frequency and severity of these flares. One important note: learning to relax is a skill, especially if you've been chronically stressed for a long time. Your nervous system needs time to recalibrate. The benefits for your skin and your overall well-being accumulate over time, just like skincare products do. Don't expect instant perfection. Some days your mind will be too busy to quiet. Some days you'll forget to practice. This is normal and okay. What matters is gently returning to the practice, again and again, with patience and without judgment. As we come to the close of our time together, embrace this beautiful truth. You carry powerful skin treatments with you always, in your breath and your capacity for relaxation. No product can replace the benefits of reduced stress, adequate oxygen, improved circulation, and your body's natural healing processes functioning optimally. Your skin is not just affected by what you put on it. It's profoundly affected by how you live, how you breathe, how you manage stress, and how you allow yourself to rest and relax. Attending to these internal factors complements your external skincare practices and often produces results that products alone cannot achieve. Take a deep, nourishing breath right now. Feel it filling your body with oxygen, activating your relaxation response, supporting your skin's health from within. This breath and every conscious breath you take, welcome and settle in. Breathe. Today we explore facial mists and sprays, those lightweight, refreshing products that can hydrate, soothe, and revive your skin throughout the day. Facial mists seem simple, almost too simple to be effective, yet they serve real purposes and can enhance your skincare routine and daily comfort. Let's understand what they do, when they're useful, and how to choose and use them effectively. What are facial mists? Facial mists are liquid formulations packaged in spray bottles, designed to be spritzed onto your face. They contain water and various beneficial ingredients depending on their purpose. Hydrating agents, soothing botanicals, antioxidants, or refreshing extracts. The mist format allows light, even application without disturbing makeup, without touching your face with your hands, and with minimal effort. It's quick, convenient, and portable. Types of facial mists. Hydrating mists focus on adding moisture to your skin. They contain humectants like hyaluronic acid, glycerin, or aloe vera that attract and hold water. These are excellent for dry, dehydrated, or tight-feeling skin. Soothing mists contain calming ingredients like chamomile, Centella asiatica, rose water, or green tea. They help reduce redness, calm irritation, and comfort stressed skin. Toning mists function like liquid toners, balancing skin pH after cleansing and prepping skin for subsequent products. Some contain gentle exfoliants or clarifying ingredients. Setting sprays are designed for use after makeup application to help makeup last longer. While marketed differently, they're essentially facial mists with film-forming ingredients. Thermal water sprays contain mineral-rich water from specific springs. They're simple, just water with naturally occurring minerals, but can be soothing and refreshing. Benefits of using facial mists. Instant Hydration Boost provides immediate relief for tight, dry, or dehydrated skin. The fine mist delivers water directly to your skin's surface. Refreshing sensation wakes up tired skin and provides a cooling, reviving feeling. This is particularly welcome in hot weather, after exercise, or during long flights. Convenience is major. No sink needed, no hands needed beyond holding the bottle. You can mist anywhere, anytime. Makeup-friendly application allows hydration without disturbing your makeup. Misting over makeup sets it and adds a dewy finish. They help other products absorb better. Misting before applying serums or moisturizers to damp skin can enhance absorption. They're portable and travel-friendly, perfect for keeping in your purse, desk drawer, or carry-on luggage. Midday Skin Rescue revives skin that feels dry, tight, or tired hours after your morning routine. When to use facial mists. After cleansing to add moisture before applying toner, serum, and moisturizer. This helps subsequent products absorb better into damp skin. Before moisturizer to dampen your skin, making your moisturizer more effective. Humectants and moisturizers work better on damp skin. Over makeup to set it, add a dewy finish or refresh your look midday without disturbing makeup. Throughout the day, whenever your skin feels dry, tight, or tired. In air-conditioned offices, during flights, in heated indoor spaces, or outdoors in dry weather. Post-workout to cool down and refresh your face after exercise, before cleansing. After sun exposure to cool and soothe skin that feels warm or irritated, before bed over your nighttime products to add an extra hydration layer. choosing the right mist. For hydration, look for hyaluronic acid, glycerin, or sodium PCA. These powerful humectants draw moisture into your skin. For soothing and calming, choose ingredients like rose water, chamomile, allantoin, Centella asiatica, or cucumber extract. For oily skin, look for lightweight, oil-free formulas, possibly with niacinamide or green tea to help control oil. For sensitive skin, choose fragrance-free options with minimal ingredients. Simple thermal water or pure aloe vera mists work well. For makeup setting, look for products specifically labeled as setting sprays with film-forming ingredients that help makeup last. Avoid mists with high alcohol content, which can be drying and irritating despite the initial cooling sensation. Check ingredients for potential irritants if you have sensitive skin. Fragrance, essential oils, and some botanical extracts can cause reactions in susceptible individuals. How to use facial mists effectively. Hold the bottle 6 to 10 inches from your face. Too close and you get droplets that run off. Too far and you get uneven coverage. Close your eyes and mouth and spray in a sweeping motion across your face. Usually 2 to 3 sprays cover your entire face. Let the mist settle on your skin for a moment, then gently pat it in with clean hands. Don't let it fully air dry, which can actually pull moisture from your skin as the water evaporates. If using before other products, wait just a moment for skin to absorb some moisture. Keeping it damp, then apply your next product. If using over makeup, hold slightly farther away and use a very light mist to avoid disturbing makeup. Throughout the day, mist as needed. There's no limit. If your skin feels good with frequent misting and isn't becoming irritated, mist away. Common mistakes with facial mists. Letting mist air dry completely can leave skin drier than before. Water evaporating from your skin can draw moisture out. Always pat in or follow with moisturizer. Using mist as your only moisturizer won't provide adequate hydration. Mists add water but don't prevent water loss. You still need moisturizer to seal in hydration. Spraying too close creates droplets that run off rather than misting your face evenly. Using alcohol-heavy mists repeatedly throughout the day can dry and irritate skin despite feeling temporarily refreshing. Expecting mist to dramatically transform skin leads to disappointment. They're supportive additions, not miracle workers. DIY versus commercial mists. You can make simple mists at home with distilled water in a spray bottle. Add a few drops of glycerin or aloe vera gel for hydration. Keep refrigerated and use within a week. Rose water or witch hazel, alcohol-free, in spray bottles make simple DIY mists. However, commercial mists often contain stabilizers, preservatives, and carefully formulated ingredient blends that provide better stability and effectiveness than simple DIY versions. If you enjoy DIY, start simple and keep preparations refrigerated. If you want convenience and sophisticated formulations, commercial options are worth the investment. Special situations for mists. Airplane travel is where mists shine. Cabin air is extremely dry. Misting every hour during long flights helps combat this harsh environment. Choose a small bottle that meets TSA requirements. Hot weather makes mists delightful for instant cooling. Keep mist in the refrigerator for extra refreshing sensation. Office environments with air conditioning or heating can dry skin throughout the day. A desk mist provides relief. Post-procedure or irritated skin benefits from soothing mists. After professional treatments, sunburn, or reactions, gentle misting can calm and comfort. Realistic expectations. Facial mists provide genuine benefits, but within reasonable limits. They add temporary surface hydration, they soothe and refresh, they help other products work better when used correctly. They won't deeply moisturize very dry skin alone. They won't cure skin conditions. They won't eliminate wrinkles or dramatically brighten skin. What they will do is make your skin more comfortable throughout the day, provide convenient hydration boosts, and enhance your overall skincare routine when used as supplements to a proper routine, not replacements for it. Budget considerations. Some facial mists are expensive luxury items. Others are quite affordable. Effectiveness doesn't always correlate with price. Thermal water sprays from fancy French springs are lovely but expensive. Regular distilled water with a good humectant works almost as well for a fraction of the cost. Read ingredient lists. If you're paying premium prices, ensure you're getting premium ingredients, not just premium packaging. That said, if a particular mist brings you joy and you can afford it, that joy itself has value. We're not robots seeking only maximum cost efficiency. Environmental considerations. Aerosol sprays raise environmental concerns. Many brands now offer non-aerosol pump spray bottles that are more eco-friendly. Consider refillable options if available. Some brands sell refills, reducing packaging waste. As we close, remember that facial mists are helpful additions to skincare routines, not essential necessities. They enhance comfort, provide convenient hydration, and can make skincare more enjoyable. If you've never tried facial mists, experiment with one to see if you enjoy it. Many people discover that misting becomes a favorite self-care moment throughout their day. A quick pause to refresh and care for themselves. If mists don't appeal to you or don't seem to benefit your skin, that's perfectly fine. Not everyone needs every type of product. Your basic routine, cleansing, treating, moisturizing, protecting, matters far more than any mist. Take a deep breath in and out. You now understand facial mists and how they might serve you. May you find refreshment in these small acts of care throughout your day. May your skin feel comfortable and hydrated. May you give yourself permission for moments of self-attention and kindness. Thank you for this peaceful time together. Mist with joy, refresh with intention, and carry comfort with you always. Hello and welcome to this peaceful moment. Take a deep breath in and gently release it. Let yourself settle into this comfortable space where we'll explore together one of skincare's most beloved ingredients, vitamin C. Vitamin C is often called the gold standard of brightening ingredients, and for good reason. It's one of the most researched, most effective, and most versatile ingredients in skincare. Yet it can also be one of the most confusing. Today, we'll gently unravel the mystery of vitamin C, helping you understand what it does, why it matters, and how to use it wisely. Let's begin by understanding what vitamin C actually is and why your skin needs it. Vitamin C, also known as ascorbic acid in its pure form, is a powerful antioxidant. Your body needs vitamin C for many functions, including the production of collagen, the protein that gives your skin its structure, firmness, and elasticity. While you can get vitamin C through your diet, applying it directly to your skin provides targeted benefits that eating vitamin C alone cannot achieve. Think of vitamin C as a multitasker for your skin. It doesn't just do one thing, it works in several important ways simultaneously. First, vitamin C is a potent antioxidant. Every day, your skin faces oxidative stress from environmental aggressors, UV radiation, pollution, cigarette smoke, and even the natural metabolic processes in your cells. These create free radicals, unstable molecules that damage your skin cells, break down collagen, and accelerate aging. Vitamin C neutralizes these free radicals before they can cause damage. It's like having a protective shield around your skin cells. Second, vitamin C brightens your complexion. It does this in two ways. It inhibits the enzyme tyrosinase, which is responsible for melanin production, and it can help fade existing dark spots and hyperpigmentation. This doesn't mean vitamin C bleaches your skin or changes your natural skin tone. Instead, it helps even out discoloration, reduces the appearance of sunspots and post-inflammatory hyperpigmentation from acne, and gives your skin a more radiant, luminous appearance. Third, vitamin C boosts collagen production. As we age, our bodies produce less collagen naturally. This leads to fine lines, wrinkles, and loss of firmness. Vitamin C is essential for the enzymes that build collagen. By ensuring your skin has adequate vitamin C, you're supporting your skin's ability to maintain its structure and resilience. Fourth, vitamin C enhances sun protection. Now let me be clear. Vitamin C is not a sunscreen and should never replace sunscreen. However, when used alongside sunscreen, vitamin C provides additional protection against UV damage. It helps neutralize free radicals generated by sun exposure and can help repair some of the damage that occurs despite sunscreen use. Now that you understand what vitamin C does, let's talk about the different forms of vitamin C you'll encounter in skincare products. Pure vitamin C, or L-ascorbic acid, is the most researched and most potent form. It's also the most unstable. L-ascorbic acid is water-soluble and highly reactive. It oxidizes easily when exposed to air, light, or water, turning from clear to yellow or brown. Once oxidized, it loses its effectiveness and can even become irritating to skin. This instability is why vitamin C serums often come in dark bottles with dropper tops, to minimize exposure to air and light. It's also why you'll sometimes hear that vitamin C products should be stored in the refrigerator. For L-ascorbic acid to be effective, it needs to be formulated at the right pH, ideally between 2.5 and 3.5, and at the right concentration, typically between 10% and 20%. Lower concentrations may not provide significant benefits, while higher concentrations don't necessarily work better and may cause irritation. Because pure L-ascorbic acid can be irritating, especially for sensitive skin, many products use vitamin C derivatives instead. These are modified forms of vitamin C that are more stable and gentler on skin. Common derivatives include magnesium ascorbyl phosphate, ascorbyl glucoside, sodium ascorbyl phosphate, and tetrahexyl decyl ascorbate. These derivatives need to be converted by your skin into L-ascorbic acid to work, which means they may be less potent than pure vitamin C. However, they're also more stable, less irritating, and still provide meaningful benefits. There's no best form of vitamin C for everyone. The right choice depends on your skin type, sensitivity level, and specific concerns. If you have resilient skin and want maximum brightening and anti-aging benefits, pure L-ascorbic acid at 15–20% concentration might be ideal. If you have sensitive skin or are new to vitamin C, starting with a lower concentration, around 10%, or a derivative form, would be gentler. Now, let's talk about how to incorporate vitamin C into your routine. Vitamin C serums are typically applied in the morning, right after cleansing and before moisturizer and sunscreen. The reason for morning application is that vitamin C works synergistically with sunscreen, providing extra antioxidant protection throughout the day when your skin faces the most environmental stress. Apply vitamin C to clean, dry skin. Use 3 to 4 drops for your entire face. You don't need much. Gently press it into your skin rather than rubbing vigorously. Give it a minute to absorb before applying your next product. Some people prefer to apply vitamin C at night, and that's fine too. The most important thing is consistency, using it regularly, whether morning or night. When you first start using vitamin C, you might experience some tingling or slight redness. This is common, especially with pure L-ascorbic acid formulations. The tingling should be brief and mild. If it's intense, or if you experience burning, stinging, or prolonged redness, the product may be too strong for your skin. Start slowly. Use vitamin C just once or twice a week initially, then gradually increase frequency as your skin builds tolerance. Most people can eventually use it daily. Be aware of potential interactions. Vitamin C can be used with most other skincare ingredients, but there are a few combinations to approach carefully. Vitamin C and retinol can be used together, but many people find this combination too irritating, especially when starting out. If you want to use both, consider using vitamin C in the morning and retinol at night. Alternatively, use them on alternate days. There's some debate about whether niacinamide and vitamin C can be used together. Older research suggested they shouldn't be combined, but more recent studies show they work fine together. If you have sensitive skin, you might prefer to separate them, but most people can use both in the same routine without issues. Avoid using vitamin C immediately after exfoliating acids, AHAs or BHAs. The low pH of acids can increase vitamin C's potential for irritation. If using both, apply acids first, wait a few minutes, then apply vitamin C, or use them at different times of day. Always use vitamin C with sunscreen during the day. Vitamin C helps protect against UV damage, but it's not a substitute for sunscreen. Let's talk about results and realistic expectations. Vitamin C works, but it's not instant magic. With consistent use, most people begin noticing a brighter, more radiant complexion within 2 to 4 weeks. Fading of dark spots and improvement in fine lines takes longer, typically 8 to 12 weeks of daily use. The key word is consistent. Using vitamin C occasionally won't give you meaningful results. This is a long-term investment in your skin's health. Some important considerations about storing and choosing vitamin C products. Always check the packaging and expiration date. Once opened, most vitamin C serums remain effective for about 3 to 6 months, though this varies by formulation. Store your vitamin C in a cool, dark place. The bathroom cabinet is fine. You don't necessarily need to refrigerate it unless the product instructions specifically say so. Watch for signs of oxidation. If your clear vitamin C serum turns yellow or brown, it's oxidized and should be replaced. Some vitamin C products are naturally yellow or orange. That's fine. What you're watching for is a change in color. If a product seems off, smells strange, has separated, or has changed texture, don't use it. Now let's address some common concerns and questions. My skin is sensitive. Can I use vitamin C? Yes, but choose carefully. Look for vitamin C derivatives rather than pure L-ascorbic acid and start with lower concentrations. Introduce it slowly and pay attention to your skin's response. I have acne-prone skin. Will vitamin C break me out? Vitamin C itself doesn't cause acne. However, the vehicle it's formulated in might. If you're acne-prone, choose lightweight, non-comedogenic serums rather than heavy cream formulations. Can I use vitamin C if I'm pregnant or breastfeeding? Topical vitamin C is generally considered safe during pregnancy and breastfeeding. However, always consult your healthcare provider about any skincare products during pregnancy. I'm not seeing results. What am I doing wrong? Results take time. Ensure you're using the product consistently, storing it properly, and using enough concentration to be effective. Also, make sure you're pairing it with sunscreen. Sun exposure can counteract vitamin C's brightening effects. As we come to the end of our time together, remember that vitamin C is a powerful ally for your skin, but it's not magic. It works best as part of a complete routine that includes gentle cleansing, adequate moisturization, and diligent sun protection. Choose a formulation that suits your skin type and sensitivity level. Store it properly to maintain its effectiveness. Use it consistently. Be patient with results. And always, always wear sunscreen. Your skin has the wisdom to respond to good ingredients when given time and consistency. Vitamin C offers that skin protection from oxidative stress, support for collagen production, and that beautiful, healthy radiance we all desire. Take a deep breath in and release it slowly. You now understand vitamin C, what it does, how to use it, and what to expect. You're equipped to make informed choices about whether and how to incorporate this powerful ingredient into your routine. May your skin be bright, healthy, and protected. May you treat it with the patience and consistency it deserves. Thank you for this time together. Be well and be radiant. Welcome, and take this moment to simply breathe. Let your body relax, let your mind quiet, and allow yourself to be fully present. Today, we're going to explore something foundational, yet often misunderstood. How to understand your skin type gently, without judgment, with curiosity and compassion. Understanding your skin type isn't about labeling yourself or fitting into rigid categories. It's about developing awareness of your skin's unique characteristics, needs, and patterns, so you can care for it in ways that truly serve it. This understanding is a gift you give yourself, a foundation for making choices that honor your skin rather than fighting against it. Let's begin by releasing any pressure or anxiety around this topic. Your skin type is not a verdict or a limitation. It's simply information. Whether your skin is oily, dry, combination, or sensitive, there's nothing wrong with it. Each skin type has its own beauty and its own needs. Your job isn't to change your skin type, it's to understand and support it. Now let's explore the main skin types gently, remembering that these are general categories and your skin might not fit perfectly into any one box. That's completely normal and fine. Let's start with oily skin. Oily skin produces more sebum, the natural oil your skin creates, than other skin types. If you have oily skin, you might notice your face looking shiny, especially in your T-zone, which is your forehead, nose, and chin. Your skin might feel greasy to the touch, particularly by midday. You might notice that your makeup tends to slide off or look shiny after a few hours. You may be more prone to enlarged pores, blackheads, and acne, because excess oil can mix with dead skin cells and clog pores. But here's something important. Oily skin isn't bad skin. Oily skin often ages more slowly because the natural oils provide protection and keep skin supple. People with oily skin frequently have fewer fine lines as they age. The oil that feels frustrating now is actually offering you benefits. If you have oily skin, your needs are centered around balance, not stripping. Many people with oily skin make the mistake of using harsh products to remove oil, which actually triggers more oil production as your skin tries to compensate. Instead, you need gentle cleansing, lightweight hydration, and products that support your skin's balance without disrupting it. Now let's consider dry skin. Dry skin produces less sebum than other skin types. If you have dry skin, you might notice your face feels tight, especially after cleansing. Your skin might look flaky or rough in texture. You might experience itchiness or discomfort. Fine lines may be more visible because dry skin doesn't have the plumping moisture that makes skin look smooth. Your skin might also be more sensitive to environmental factors like cold weather or low humidity. Dry skin needs gentle care that focuses on hydration and moisture retention. Rich, nourishing products that deliver water to your skin and seal it in are your friends. You want to support your skin's moisture barrier, which may be naturally weaker in dry skin types. It's important to distinguish between dry skin, a skin type that doesn't produce much oil, and dehydrated skin, which is a condition where skin lacks water. You can have oily skin that's dehydrated or dry skin that's well hydrated. Understanding this distinction helps you address the right issue with the right solutions. Let's explore combination skin. Combination skin is exactly what it sounds like, a combination of different characteristics in different areas. Typically, this means an oily T-zone with dry or normal cheeks. You might notice shine and larger pores on your forehead, nose, and chin, while your cheeks feel normal or even tight and dry. Combination skin can feel confusing because different areas seem to want different things. The key is finding balance. You don't necessarily need different products for different zones, though you can adjust if needed. Many people with combination skin do well with balanced, moderate products. Not too heavy, not too light, used all over. Remember that combination skin is extremely common. You're not difficult or complicated. Your skin just has varied characteristics, which is perfectly normal. Now, let's discuss sensitive skin. Sensitive skin isn't so much about oil production as it is about reactivity. If you have sensitive skin, you might notice redness easily, whether from products, temperature changes, or stress. Your skin might sting or burn when you apply certain products. You might experience irritation, itching, or rashes more easily than others. Your skin might react to fragrances, certain ingredients, or even changes in weather. Sensitive skin needs gentleness above all else. Minimal products with minimal ingredients. Fragrance-free formulas. Careful introduction of any new products. Patience and attentiveness to what triggers reactions. It's worth noting that sensitive skin can be a temporary condition caused by barrier damage, not necessarily an inherent skin type. If your skin has become sensitive after using harsh products or over-exfoliating, it may calm down once you repair your barrier with gentle care. There's also normal skin, sometimes called balanced skin. This is skin that doesn't tend toward excessive oiliness or dryness, doesn't react easily, and generally feels comfortable. If you have normal skin, consider yourself fortunate and focus on maintaining that balance with simple, consistent care. Now, how do you determine your skin type? Let's walk through this gently. The cleansed skin test is a simple starting point. Wash your face with a gentle cleanser. Pat it dry and don't apply any products. Wait about an hour, then observe and gently touch your skin. How does it feel? How does it look? If your entire face feels tight and looks a bit dull or rough, you likely have dry skin. If your entire face looks shiny and feels oily, especially in your T-zone, you likely have oily skin. If your T-zone is shiny but your cheeks feel comfortable or slightly dry, you have combination skin. If your skin feels comfortable all over without being oily or tight, you likely have normal skin. The blotting paper test can also provide insight. About 2 or 3 hours after your normal morning routine, press a blotting paper against different areas of your face. Hold it up to the light. If you see substantial oil on the paper from all areas, you have oily skin. If you see oil only from your T-zone, you have combination skin. If you see little to no oil, you have dry or normal skin. Pay attention to how your skin behaves throughout the day. Does it get progressively shinier as hours pass? That suggests oily skin. Does it feel increasingly tight or uncomfortable? That suggests dry skin. Does it stay relatively comfortable? That suggests normal or well-balanced skin. Notice how your skin responds to products. Does it soak up rich creams and still want more? You likely have dry skin. Do heavy creams make you break out or feel greasy? You likely have oily skin. Do you react to many products with redness or stinging? You have sensitive skin. Consider seasonal variations. Your skin type can shift somewhat with seasons. You might have oily skin that becomes more combination in winter, or dry skin that becomes normal in humid summer months. This is natural. Your skincare routine can adapt slightly to these changes. It's important to understand that your skin type can change over time. Hormonal shifts, aging, climate changes, stress levels, and even medications can affect your skin's oil production and sensitivity. The skin type you had at 20 might not be the same at 40. Stay attentive and be willing to adjust your understanding and your routine.
They kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Isotretinoin can cause temporary initial acne worsening, flaring, as sebaceous glands adjust and dead skin cells are shed. This flaring is temporary and can be managed with topical treatments or low-dose oral corticosteroids in severe cases. Muscle and joint pain occur in some patients, typically mild but sometimes bothersome. This side effect often improves with continued use or resolves after treatment stops. Who is an appropriate candidate for isotretinoin? Severe nodular acne with risk of scarring is the classic indication. Acne resistant to maximum dose oral antibiotics combined with topical retinoids for at least 3 to 4 months is another strong indication. Any acne causing significant psychological distress or affecting quality of life substantially is also appropriate. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22. Oral antibiotics for acne, types, mechanisms, resistance, and long-term management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side. Caffeine and alcohol intake timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or mattifying for makeup. Overnight hydrating masks provide intense hydration during sleep. Some people use occlusive oils, just a few drops of facial oil over moisturizer, to lock in maximum hydration overnight. Retinoid application at night leverages sleep's restorative processes. Applying retinoids in the evening, or before bed if your routine allows, means they work while your skin undergoes growth and repair during sleep. This timing often provides better results than morning retinoid application, though this varies individually. Acne spot treatments can be applied before bed to work overnight without interfering with daytime activities. Leaving benzoyl peroxide or other treatments on overnight provides extended contact time for therapeutic benefit. Silk or satin sleep masks or pillowcases are promoted for anti-aging and acne benefits. The reduced friction might slightly reduce acne, and the reduced moisture absorption compared to cotton might help slightly, but these effects are modest compared to other acne management strategies. If you like the feel of silk pillowcases and can afford them, they're worth trying, but they're not necessary for acne management. Optimizing sleep requires a multifaceted approach, maintaining 7 to 9 hours nightly, keeping consistent sleep schedules, avoiding evening screen use, limiting caffeine after 2 p.m., maintaining cool, moderate humidity bedroom, and changing pillowcases frequently. These changes take 2 to 3 weeks to impact acne, but most people notice significant improvement in acne after optimizing sleep long-term. Sleep is one of the most underrated acne management strategies. While topical treatments and professional treatments receive most attention, sleep optimization often provides dramatic acne improvement that rivals pharmaceutical treatments. Prioritizing sleep is one of the highest impact acne management strategies available. Guide 35, Water Quality, Hydration Science, and Optimal Water Intake for Clear Skin. While drink water for clear skin is commonly repeated, the mechanisms behind water's role in skin health and the specific amount of water actually needed for acne improvement are often misunderstood. Understanding water science and optimal hydration supports acne management. The myth that specific water quantities, 8 glasses daily, etc., directly treat acne is oversimplified. While adequate hydration supports overall health and skin function, consuming excessive water beyond your actual hydration needs doesn't further improve acne. However, maintaining proper hydration throughout the day supports skin health in multiple ways. Dehydration compromises skin barrier function. When your body is dehydrated, your skin compensates by producing more sebum to maintain oil barrier protection. Paradoxically, dehydrated acne-prone skin often appears oily while being dehydrated internally, creating conditions promoting acne. Proper hydration reduces this compensatory sebum production. Hydration supports skin cell function. Skin cells require water to function optimally. Proper hydration maintains cellular processes, supports detoxification, and promotes overall skin health. Dehydrated skin appears duller and is more prone to irritation and breakouts. Hydration supports immune function. Adequate hydration maintains lymphatic function and immune cell circulation, supporting your body's ability to fight acne-causing bacteria. Dehydration compromises immune function, potentially worsening acne. Hydration supports blood circulation. Well-hydrated blood flows more efficiently, delivering nutrients and oxygen to skin cells. Dehydration compromises circulation, reducing nutrient delivery to skin. Optimal daily water intake varies based on body weight, activity level, climate, and individual factors. A general guideline is 35 milliliters per kilogram of body weight daily. For a 70 kilograms person, this equals approximately 2.5 liters, about 10 glasses, daily. However, individual needs vary significantly. Thirst is a reasonable indicator of hydration needs. Drinking when thirsty and monitoring urine color. Pale yellow indicates adequate hydration, dark yellow suggests dehydration, guides appropriate intake. individual variation in optimal water intake is substantial. Some people need 2 liters daily for optimal hydration, while others need 3 to 4 liters depending on activity and climate. Rather than following a rigid 8 glasses recommendation, assess your personal hydration status and drink accordingly. Water intake timing matters somewhat. Distributing water intake throughout the day maintains consistent hydration better than consuming large amounts at once. However, excessive water intake shortly before bed disrupts sleep through nighttime urination. Tapers off water intake 2 to 3 hours before bed to optimize sleep quality. Electrolyte balance matters for hydration beyond pure water intake. Excessive water intake without sufficient electrolyte intake, sodium, potassium, magnesium, can disrupt electrolyte balance, causing problems. Consuming electrolyte-containing beverages or foods alongside water maintains balance. However, the Western diet typically contains adequate sodium, so electrolyte concerns are minimal for most people unless they're exercising extensively or sweating significantly. Water quality affects skin and acne through multiple mechanisms. Hard water, high mineral content, leaves mineral buildup on skin, potentially irritating it and compromising cleansing efficacy. Soft water cleanses more effectively. If you have very hard water, installing a water softener or using a shower filter might help. However, evidence for hard water directly worsening acne is limited. Chlorinated water can irritate acne-prone skin. Chlorine is drying and potentially irritating. Using filtered water for cleansing if you have highly chlorinated tap water might help. However, most chlorine in tap water is minimal and unlikely to significantly impact acne. Hot water is more drying to skin than lukewarm or cool water. Cleansing with lukewarm water rather than hot water reduces water-related dryness, particularly important for acne-prone skin already potentially compromised by active treatments. Distilled water versus tap water has minimal practical difference for skin health. Distilled water is free of minerals and chlorine but also lacks beneficial minerals.
Welcome to this gentle space. Breathe and relax. Today we're focusing on an area often neglected in skincare routines, but deserving of care and attention. Your lips. Your lips are unique. Unlike the rest of your skin, they have no oil glands. They cannot moisturize themselves. They have a much thinner outer layer, making them more vulnerable to environmental stressors, and they're constantly exposed to weather, to food and drink, to frequent movement as you speak and smile. All of this means your lips need conscious care to stay soft, comfortable, and healthy. Let's understand common lip concerns and what causes them. Dry, chapped lips are the most common complaint. Without oil glands, lips lose moisture easily. Cold, dry weather accelerates this water loss. Indoor heating further dehydrates the air and your lips. Sun exposure without protection damages the delicate lip skin. Licking your lips provides only temporary relief and actually makes dryness worse as saliva evaporates and takes more moisture with it. Certain medications, particularly those that dry mucous membranes, can affect lip hydration. Dehydration affects your entire body, including your lips. Cracked or split lips often result from severe dryness. The thin skin breaks, sometimes painfully. Angular colitis, cracking at the corners of the mouth, can result from vitamin deficiencies, yeast infections, or excessive moisture from drooling or lip licking. Peeling lips happen when dead skin cells accumulate. This is exacerbated by dryness and sun damage. The temptation to bite or pull at peeling skin usually makes the problem worse. Cold sores are caused by the herpes simplex virus. These aren't the same as chapped lips. They're fluid-filled blisters that are contagious. Cold sores require specific antiviral treatment, not just lip balm. Dark or pigmented lips can result from sun exposure, smoking, certain medications, or simply your natural coloring. Some people naturally have more pigmented lips than others. Understanding these issues helps you address them appropriately. Now let's discuss how to care for your lips effectively. The foundation of lip care is protection and moisture. A good lip balm becomes your best friend, but not all lip balms are created equal. Look for lip balms with truly moisturizing ingredients. Occlusives like petroleum jelly, beeswax, or shea butter create a protective barrier that prevents moisture loss. Humectants like hyaluronic acid or glycerin attract moisture to your lips. Emollients like plant oils, cocoa butter, or lanolin smooth and soften. The best lip balms contain a combination of all three types of ingredients. Avoid lip balms with irritating ingredients. Fragrance and flavor can be irritating, especially if your lips are already chapped. Menthol, peppermint, and eucalyptus feel cooling but can actually be irritating and drying for some people. Camphor can be irritating. Salicylic acid is sometimes included in lip products, but it can be too harsh for very chapped lips. SPF protection in lip balm is valuable. Your lips can get sunburned and are vulnerable to sun damage. If your lip balm doesn't contain SPF, consider a separate lip sunscreen, especially if you'll be outdoors for extended periods. Apply lip balm generously and frequently. Unlike face moisturizer that you apply twice daily, lips need more frequent attention. Apply whenever your lips feel dry. This might be several times throughout the day. Apply before bed so your lips can recover overnight. Apply before going outside in cold or windy weather. Don't wait until your lips are already painfully chapped. Prevention is easier than repair. Make lip balm application a habit, not an emergency response. Let's talk about what not to do, because some common habits actually worsen lip problems. Stop licking your lips. This is the most important habit to break. Saliva contains digestive enzymes that break down the delicate skin of your lips. When saliva evaporates, it takes moisture with it, leaving your lips drier than before. If you catch yourself licking your lips, reach for lip balm instead. Don't bite or pick at peeling skin. This damages healthy skin underneath and creates more peeling. If you have loose flakes, gently exfoliate as we'll discuss shortly, but don't tear at your lips. Avoid lip products that make your lips feel tingly or burny unless that sensation quickly passes. Persistent burning or stinging means the product is irritating your lips. Many people become addicted to mentholated balms because they create a sensation that feels like it's helping, but they're actually causing low-level irritation that makes you need more balm. Don't use harsh or drying lipsticks without proper base care. Some long-wearing lipsticks are very drying. If you wear these, prep your lips with treatment balm first and remove lipstick thoroughly at day's end. Now let's discuss gentle lip exfoliation, because sometimes lips need help shedding dead skin. When your lips are very dry and peeling, gentle exfoliation can help, but emphasis on gentle, aggressive scrubbing damages delicate lip skin. You can use a soft toothbrush dampened with water to very gently brush your lips in circular motions for about 30 seconds. This removes loose, dead skin without trauma. A soft, damp washcloth can serve the same purpose. Gently rub your lips in circular motions. You can make a simple lip scrub with sugar and honey or oil. The sugar provides gentle physical exfoliation, while honey or oil moisturizes. Use a tiny amount, massage very gently for 30 seconds, then rinse and apply lip balm. Some lip scrubs are available for purchase. Choose ones with fine, round, exfoliating particles rather than harsh, jagged ones. Exfoliate no more than once or twice a week and only when needed. Over-exfoliation irritates and thins the skin. Always follow exfoliation with moisturizing lip balm. If your lips are cracked or bleeding, don't exfoliate at all. Just moisturize and protect until they heal. Let's talk about intensive lip treatments for severely dry or damaged lips. Overnight lip masks or treatments provide intensive moisturizing while you sleep. These are typically very rich, occlusive formulas. You can use a specialized lip sleeping mask or simply apply a thick layer of a very emollient lip balm or even pure lanolin before bed. Petroleum jelly is an inexpensive but effective occlusive treatment. Applied generously overnight, it seals in moisture and allows lips to heal. Some people find that applying hyaluronic acid serum to damp lips, then sealing with an occlusive balm provides intense hydration. For very stubborn dryness, you might try slugging your lips, applying a thick layer of an occlusive like petroleum jelly or a rich balm over your regular lip treatment. This is especially effective overnight. Now let's discuss lipstick and lip products and how to care for your lips while using them. If you wear lipstick, prepare your lips first. Exfoliate if needed the night before for smoothest application. Apply a moisturizing lip balm, let it absorb, then apply lipstick. Choose lipsticks that contain moisturizing ingredients rather than purely matte, drying formulas. If you love matte lipsticks, accept that they're drying and compensate with extra care. Treatment before application and gentle removal afterward. Remove lipstick thoroughly at the end of the day. Use an oil-based remover or cleansing balm designed for makeup removal. Don't scrub hard. Let the remover dissolve the lipstick, then gently wipe away. After removing lipstick, cleanse your lips
and lifestyle optimization become increasingly important during menopause. Pregnancy acne occurs in some pregnant women due to hormonal changes. Treatment options are limited during pregnancy because many acne medications are contraindicated. Isotretinoin is absolutely contraindicated due to severe teratogenic effects. Retinoids are generally avoided. Oral antibiotics like doxycycline are contraindicated. Spironolactone is contraindicated due to potential effects on male fetus development. Safe treatment options during pregnancy include topical benzoyl peroxide, topical azelaic acid, topical salicylic acid, though large-scale systemic absorption is theoretically possible with large area application, and it's best used sparingly, and possibly topical clindamycin. Most women manage pregnancy acne with these limited options, prioritizing safety. Some pregnant women actually experience improvement in acne due to pregnancy hormonal changes, while others experience worsening. Postpartum acne sometimes occurs as hormones shift again after delivery. This usually resolves within several months, though if breastfeeding is occurring, some hormonal factors may persist. Standard acne treatments are generally safe while breastfeeding, though some medications require careful consideration. Discuss specific medications with your healthcare provider if treating acne while breastfeeding. Age-related changes in acne treatment tolerance are important. Adolescent skin is generally very resilient and tolerates aggressive treatment well. Aging skin becomes more sensitive and drier, requiring gentler treatments and more aggressive moisturizing even if using the same medications. An adolescent might tolerate 2% salicylic acid daily with minimal dryness, while a 45-year-old woman with the same treatment might experience excessive dryness and irritation, necessitating reduced frequency or concentration. Transitional acne between life stages sometimes occurs. A teenager transitioning to adulthood might experience changing acne patterns. An adult woman starting hormonal contraceptive might initially experience worsening acne before improvement. A woman entering perimenopause might experience acne worsening despite previous successful acne control. These transitions require reassessment and potential treatment adjustments. Psychological impact varies with age. Adolescent acne causes significant psychological distress due to developmental sensitivity about appearance and peer dynamics. Adult acne can cause depression and anxiety, particularly if unexpected after years of clear skin. Menopausal acne can be particularly frustrating as women are simultaneously managing other menopausal symptoms. Acknowledging the psychological impact and treating acne aggressively for mental health reasons is justified. Understanding your life stage allows you to set appropriate expectations and select appropriate treatments. Adolescents should prevent lifelong acne through good habits. Adults should identify contributing factors, stress, hormones, products, specific to their life circumstances. Menopausal women should recognize acne as a normal menopausal symptom and pursue appropriate treatment. Pregnant women should prioritize safety while still treating acne to maintain mental health. Postpartum women should understand that acne often resolves as hormones stabilize. Guide 26. Post-acne skin barrier repair and restoration after aggressive treatment. After intensive acne treatment, your skin barrier often requires dedicated repair and restoration. Understanding skin barrier function, signs of barrier compromise, and recovery strategies is essential for returning to healthy, resilient skin after aggressive treatment phases. Your skin barrier, also called the stratum corneum, consists of dead skin cells, corneocytes, bound together by lipids, creating a protective wall that prevents water loss and keeps irritants and pathogens out. When functioning optimally, your barrier is resilient, hydrated, and protective. When compromised by aggressive acne treatment, the barrier becomes thin, allows excessive water loss, and becomes reactive to previously tolerated products and environmental factors. Signs of barrier compromise include tightness and discomfort, increased dryness and flaking despite using moisturizer, redness or inflammation without active acne, stinging or burning when applying products previously tolerated, increased sensitivity to temperature extremes, and heightened reactivity to skincare products, developing reactions to products that previously seemed fine. Several factors compromise the skin barrier during acne treatment. Multiple chemical exfoliants, salicylic acid, glycolic acid, used simultaneously strip away protective lipids excessively. Retinoids, while beneficial, can compromise the barrier during the initial adaptation phase. Benzoyl peroxide can be somewhat drying. Hot water and harsh cleansing compromise the barrier. Excessive sun exposure damages barrier function. The cumulative effect of multiple treatments or very aggressive single treatments overwhelms the barrier's ability to maintain function. Barrier repair requires specific approaches different from standard acne skincare. The goal shifts from treating acne to restoring skin health. This recovery phase typically lasts 2 to 4 weeks but can take longer with severe barrier compromise. The first step in barrier repair is stopping all unnecessary irritants. This means discontinuing strong actives temporarily. Stop salicylic acid, benzoyl peroxide, and retinoids. Stop chemical exfoliants. Stop high-concentration vitamin C or other potentially irritating ingredients. Use only gentle, basic skin care during the recovery phase. Gentle cleansing becomes paramount. Use only lukewarm or cool water with a very gentle, minimal cleanser or even just water cleansing. Avoid all manipulation or massage of the skin. Pat dry gently, don't rub. Minimize cleansing time, wash quickly and gently rather than scrubbing or massaging. Lipid-rich moisturizing is essential. Your barrier needs ceramides, cholesterol, and fatty acids. Moisturizers containing these lipids support barrier repair. Apply moisturizer to slightly damp skin immediately after cleansing to lock in hydration. Use generous amounts, don't skimp on moisturizer during barrier repair. Many people find that using moisturizer 3 to 4 times daily during barrier repair accelerates recovery compared to twice daily application. Humectant-rich products maintain skin hydration. Ingredients like hyaluronic acid, glycerin, and squalane draw water into the skin, supporting hydration during barrier repair. Many hydrating serums or essences contain these ingredients. Apply these before your moisturizer to layer hydration. Some people benefit from occlusive products during barrier repair. An occlusive final layer locks moisture into skin. Facial oils, jojoba, squalane, or balms create an occlusive layer over your moisturizer. This is particularly helpful at night when you're not exposed to environmental stressors. Centella asiatica, SACA, is a botanical ingredient that supports skin barrier repair through multiple mechanisms. It strengthens the barrier, reduces inflammation, and promotes skin resilience. Many products now contain SACA for its barrier-supportive properties. Using a SACA-containing product during barrier repair can accelerate recovery. Avoid all environmental stressors during barrier repair. Don't expose skin to extreme temperatures, hot showers, very cold weather. Use a humidifier to maintain ambient humidity, as dry air worsens barrier compromise. Avoid air conditioning when possible, it's drying, or use a humidifier to counteract its effects. Protect skin from sun exposure. Wear sun protection even though you're not using UV sensitizing treatments. Avoid actives and potential irritants completely during barrier repair. This means no vitamin C, no niacinamide in high concentrations, no peptides, no strong antioxidants. Even gentle ingredients might irritate severely compromised skin. Stick to cleanse, hydrate, moisturize, protect as your only routine. Timeline for barrier recovery typically takes 2 to 4 weeks. By week 1, you should notice reduced tightness and reactivity. By week 2, increased tolerance and reduced dryness. By week 3 to 4, most barrier compromise resolves. However, severely compromised barriers might take 6 to 8 weeks for complete recovery. During barrier recovery, you can still protect your skin from future acne. Using SPF 30+ sunscreen is essential and doesn't compromise recovery. In fact, it supports it by protecting your recovering skin. Sunscreen should be your only active product during this phase. Once your barrier has recovered, you're comfortable, no longer experiencing tightness or reactivity, and your skin feels resilient again, you can gradually reintroduce active treatments. However, do so carefully and at lower concentrations and frequencies than you used before. For example, if you were using 2% salicylic acid daily before barrier compromise, restart with 0.5% salicylic acid 2 to 3 times weekly. Build up slowly. Reintroduce treatments one at a time, waiting at least 1 to 2 weeks between introducing new actives. For example, reintroduce salicylic acid first, wait 2 weeks to ensure tolerance, then introduce benzoyl peroxide if desired. This sequential approach prevents recompromising your barrier. The barrier repair phase teaches valuable lessons about acne treatment. It emphasizes that more aggressive treatment isn't always better. Often, moderate treatment applied consistently yields better long-term results than aggressive treatment causing barrier compromise requiring recovery phases. Maintaining a healthy barrier improves overall skin health and can actually improve acne outcomes by supporting skin function.